Hey, how you doing today?
Hi, doing good.
Good. I'm Dr. Marcus.
I'm Eric.
Eric, nice to meet you. So today we're going to do an evaluation of your spine. So for purpose of palpation, do you mind removing your shirt due to processes of evaluation of your cervical region down to your belt line?
That's fine.
And do you mind if I actually palpate you for purposes of evaluating your spine?
That's perfect.
Okay. So if you go ahead into the changing room, I'll go ahead and check the table for you real quick.
All right.
Table feels sturdy. All right, Eric, so what we're going to start off with doing is a general scan of your spine. So may I have you take a seat facing the windows here? Right there. What we're going to do first is check the SI joints. Do you mind if I roll your britches down a little bit?
Perfect. Go ahead.
Bisect the iliac crest. Coming down to the SI joints. What I want to do first, stabilize the patient with my indifferent hand. And press P to A and medial to lateral. The SI joint on the right side appears healthy. The SI joint on the left side may be need further evaluation. We'll come back to that area later after I complete the general scan. I feel a slight restriction at the level of L1. So what I want to do first is actually evaluate this. Using the Gonstead listing system, we already have a P, which is posterior for the spinous process. Eric, can I have you cross your arms for me? There you go. So what I want to do is come to the L1, L2 spinal segment, just to check it, to see which area of restriction actually is present. Start off with lateral rotation. Flexion, extension, the spinal segment of L1 is definitely area of restriction. So coming from here, the left side, again lateral rotation. Coming to the right side. It appears to have a right side restriction. Last but not least, lateral bending. Okay, in this particular region, the joint that I found of L2 is posterior. It's more to the right, so it'll be a PR, and it's also an I, because it does not collapse when doing lateral flexion to the
left-hand side.
That means the joint is already decreased, so the side of the open wedge will be in the left, so it's a PRI. Continuing, let me relax your arm. Continuing the general scan. Eric, let me bring your arm back for me. Checking the level and relax your arm. Let me go across. We have T7, T8, palpating inferiorly, T9, T10. The T10 spinal segment. Here, I want to check the same motions. Here, go ahead and cross your arms. Start with flexion. Extension. Left rotation. Right rotation. want to check for lateral bending. Okay. The T10 spinal segment appears to have a restriction posteriorly and also restricted to the right when going in a right rotation. As far as bending goes, it appears to collapse and move freely, so it just be, in this case, it would just be a PR. Spinal segment of T10. Look at it, bring your arm behind the back. If your voice active, go ahead and relax your arm. T7. T10 spinal segment. I want to go up 1 inch spine space. Out laterally 2 inches. Check for elevation. I'm going to have Victor cross his arms. Flexion, constant rotation. Check for elevation. Check for depression. Superior border of the costal. Cross the left arm for me, behind the back. Just to double check my spinal segment, but relax. Along your spine space. This time's to the left, 2 inches. Cross your arms for me. Check the elevation. Checking for depression. And relax for me. For the elevation of the ribs, what we want to do is stand on the patient's contralateral side. So if you're checking the right rib, you want to stand on the patient's left side in a seated position or a close position to the patient. What you do, you contact the inferior border of this costal, what you're trying to palpate. In my case, I'm looking for the T10 rib. Go on to the inferior border. What you want to do is put the patient in slight flexion, as well as contralateral lateral bending and contralateral lateral rotation to the left, if I'm checking the right. The same thing applies for the left side as well. In that motion, what I'm trying to do is bring the patient to flexion, lateral or contralateral lateral bending and rotation, and spring the joint after going to in play to elevate the joint to see if it moves freely. In Eric's case, it does on both sides. The line of drive using my thumb pad is medial to lateral, I to S, and slight P to A. For depression, what I want to do is stay on the ipsilateral side of the same rib. So in Eric's case, the right rib, I'm looking for the depression of the rib. In order to do that, what I want to do is put Eric into slight extension, as well as ipsilateral lateral rotation and ipsilateral lateral bending. This will depress the rib, as well as exhale. Exhaling will depress the rib. The same line of drive applies, only in the reverse motion. Instead of going I to S, I'll be going S to I, lateral to medial, and slight P to A as well. This looks for the motion between the rib angles. And Eric's joint appears to be healthy during both processes on the left and right hand side of elevation and depression of the rib. Go ahead and relax your arms. Continuing the general scan. Go into the cervical region. at this level, we want to check the level of occiput and also C1. In order to do this, I want to palpate slightly inferior of the mastoid process, contacting the patient's cranium. Just relax from here. So I want to do a scooping motion to check for the patient's extension. I can also do something like this. Watching the chin protract in front of the nasal. Coming off the mastoid again. I want to check the flexion. Watching the chin and jawline retract back into the patient. Next, I want to check for rotation. All right, and also lateral bending. Alright, if I can have you just go ahead and close your eyes for me. What you're going to do is put your hands in flexion extension. Alright, look up and look down until you feel comfortable. Until you stop. Once you come back to a neutral position where you think your head's straight ahead. Go ahead and stop. During the evaluation on the cervical spine, what I was looking for was areas of restriction during flexion, extension, left and right lateral bending, as well as rotation to the left and to the right. My contact point was coming around over the Eric's head for support, having a contact at the top of his head and also around the mastoid process at the base of the occiput, coming slightly posterior to the mastoid process to contact the TVP. What I was looking for in rotation was to see if the TVP would actually shift after assessing for infield. During both ways, for the left and also to the right, Eric's TVP had perfect motion and joint mobility. Also, for left and right lateral bending, what I was looking for was the collapse of the joint space on both sides during left and right lateral bending. For this same contact, however, instead of trying to create a motion to where the whole neck turns, what you're looking for is to keep the nose directly over the episternal notch. So, keeping the nose in mind, Eric's head was more so here versus being over here. As long as the center line is here, you know you're in the right motion. So checking this process, my contact point for checking the left side, my indifferent hand would be the right side, mostly for stabilization and also to turn the bus. So turning the wheel of the bus, coming across, going to full tension, and then checking joint resiliency by springing the joint, coming through. For flexion extension of the cervical spine, my contact point, I did two contacts actually. The first one where I supported Eric's head using what Dr. Tom likes to call the Spock fingers around the ears, using my thumb pads to protract and retract Eric's chin. Looking for the mental process to actually protract and retract. Retraction is for flexion, protraction is for extension. And this is to actually assess whether or not the joint or the C1 is more posterior or anterior. During Eric's joint evaluation, what I found was his nose indicated that he was in a cocky position, so that indicates an S. As well as Eric had restriction during extension of the cervical spine, so that would indicate a P. As far as left and right rotation goes, Eric had perfect rotation to the left and also rotation to the right, as far as the TVP goes of C1. As far as extension goes, or left and right lateral bending, the joint space seemed to fall in line on both sides with free range of motion, as well as no contraindications of any kind of pain or joint discomfort from Eric as well.